Regular cleaning versus deep cleaning. How do you know which one you need? Let's find out. What is up, guys? Welcome back to my channel.
Me too.
Today we're going to talk about one of the most commonly asked dental questions. Cleanings, but not just regular cleanings. By the way, I deep cleaned my place over the weekend and it looks spotless. It's one of the best feelings ever. Today we are talking dental cleanings. In fancy dental terms, we call deep cleanings scaling and root planing, aka SRP. Back in the day when technology wasn't advanced enough, dentists had to hand clean every one of your teeth one by one. Scrape this way, that way, this way. Sounds terrible. So inefficient. Thankfully, modern day dentistry, we have this thing called Cavitron, an ultrasonic scaling machine that adds irrigation and allows us to clean more efficiently and faster. It's amazing. To put it simply, regular dental cleaning is like vacuuming only the outer surfaces of your couch, whereas deep cleaning, you're vacuuming the deep spaces beneath the cushions that collect hair, change, crumbs, and even hide your remote control. You know exactly where I'm talking about. So let's jump right into what determines if someone needs a regular cleaning or deep cleaning. Besides the really obvious things, such as swollen red puffy gums and copious amount of hard, nasty tartar, we call that calculus, by the way, in fancy dental terms. There are several pivotal factors that we dentists look for. Number one, age. Little babies, little kids, teenagers do not need deep cleanings. Older teenagers may experience gingivitis, but that is not an indication that they need deep cleaning. I've only performed regular cleanings on kids, and usually that is sufficient. Just gotta repeatedly remind them how important dental hygiene is, and hopefully they freaking listen. On the contrary, the older you get, the higher the chance you may need a deep cleaning, especially if you've been skipping out on your 6-month dental appointment. Which leads us to pocket depths. These are the depth of your gum pockets around your teeth. This is exactly why your dentist or your dental hygienist pokes around your gums. And yes, it is freaking annoying, but we have to do it. The reason why we poke is to measure the depth of these pockets. 1 millimeter in dentistry is like a mile. 1 to 3 millimeter pockets are considered healthy. A couple of 4 millimeters here and there, fine, I'll take it. I'm not too worried. Regular cleaning should suffice. However, once we start seeing 5, 6, 7 millimeters, that's automatic yes to deep cleaning. If you have deep pockets, that means your gums have lost a lot of the attachments to your teeth and are now looser. Deeper and looser gums mean they're gonna harbor and trap more bacteria over time. And there is no way in hell your floss and your toothbrush can go way down there and help you clean. Once we deep clean you thoroughly and you take the proper precautions, we do see improvement in these pocket depths, which is an indication some of these gum attachments have regenerated. By the way, guys, these are brand new scrubs my sponsor Mediclo sent me. Honestly, I think I look like I'm ready to go to space. Looks like one of those little things you wear underneath your spacesuit. Use my code NEEDENTAL for 15% off if you are in need of new sets of scrubs. Number 3, bone loss. As we age, we naturally lose some of the bone around our teeth. That's inevitable. It happens from all the forces that our teeth incur, eating, clenching, etc. However, when you have periodontal disease or gum disease, the rate at which you lose bone around your teeth is significantly accelerated. You have no idea how many patients I've seen where their teeth are perfectly fine, not a single stain, not a single cavity, but because they have really bad periodontal disease, their teeth are loose and now we don't have a choice but to pull them. Dentists have this emotional attachment to teeth. So put yourself in our shoes. We're pulling perfectly healthy teeth. There's nothing wrong with them besides the gums, the foundation. They've lost it all. There's no bone around it, so now the tooth is barely hanging. It's the saddest thing ever. It should be illegal. I always feel guilty pulling healthy teeth. That is why I emphasize so much about improving dental hygiene to little kids, because that's when it all starts. I've also seen patients whose x-rays show a significant amount of bone loss, but I come to find out they're only in their 30s. Based on their x-rays alone, I would have guessed they're in their 50s at least. So what would deep cleaning do in this case? It helps slow down the bone loss. Remember, it's inevitable. It's gonna happen. It's going to continue to happen as we age, but we're controlling it. We're treating it, we're controlling it, and we're slowing it down. I always emphasize to my patients, periodontitis, periodontal disease, is like diabetes. It's treatable, but it's incurable. After you get your deep cleaning, you have to return every 3 months for your maintenance cleaning. Otherwise, all the effort goes to waste. And obviously, the patient has to step up their dental hygiene at home. So those 3 things are the main criteria I look at to determine whether a patient needs a regular cleaning or deep cleaning. One thing for sure is periodontal disease is preventable. It goes healthy gums, gingivitis, periodontitis. When someone is experiencing gingivitis, it can be reversed and go back to healthy gums. But once we go past gingivitis and enter the periodontitis territory, like I mentioned earlier, it's too late. It is only treatable, not curable. If you have any questions, please feel free to leave a comment down below. I read every single comment. I answer every single comment as well. If you enjoyed the video, please don't forget to hit the subscribe button. And as always, I will see you next time. Peace!